This is Channel 9 Eyewitness News at 4. Coverage you can count on.
All new at 4. Governor Ron DeSantis has issued a new executive order calling for Floridians to stay at home.
To limit movements and personal interactions outside the home to only those necessary.
We're breaking down how the order impacts you. Plus, today was the first day of new testing guidelines at Orange County's Convention Center. The message officials have for people who want to get tested. And breaking right now, at any moment, Orange County leaders will give another update on what they're doing to fight the coronavirus. In the last few hours, the governor said he is issuing that order after consulting with President Trump and White House advisors who say Americans need to stay home through April. I'm Vanessa Eccles.
And I'm Greg Wormuth. Just big news today. Now, that order goes into effect for all of Florida at 12:01 a.m. Friday. We have a lot going on right now. First things first, let's start right here in the Orlando area. As you can see inside live of the Orange County Administration Center, where officials again will be giving their update. They've been doing this right about 4 o'clock every day. There you see the public information officer, Jeff Williamson. He is surveying, make certain everybody is 6 feet apart and that the news media is ready and gathered. They typically give us a 10-second countdown as well. So as we wait that, I want to give you some numbers out of Orange County. Total cases now are up to 392. 364 residents, non-residents 27. The demographics are the same as they really were yesterday. We've had that infant and also a patient all the way up to 91 years old. In terms of male, female, men 220 cases, women 171. And in terms of conditions and care, we're still sitting in Orange County at 4 deaths. Statewide, we are now over 7,000 cases, jumping 214 overnight. Our death toll here in Florida rose from 85 deaths to 87 deaths. Every local county except Volusia saw an increase in cases overnight. Again, Orange County still leads our area in cases with nearly 400. Let's listen in.
And good afternoon, everyone. Thank you so much for joining us on our continued opportunity to brief the media and the public in Orange County on the coronavirus as it relates to our local area. To brief us on the local activities is our Mayor, Jerry L. Demings, the Mayor of Orlando, Buddy Dyer, Dr. Yolanda Martinez, and Dr. Raul Pino from the state. We will start with the update from our Mayor, Jerry Demings. Mayor.
All right. Thank you, Dr. Williamson, and thank you to all of you for being here this afternoon. In addition to Mayor Dyer, we have County Commissioner Moore, who has joined us as well. We appreciate her presence. We, this afternoon, will give you an update in just a moment about the numbers here within Orange County. Dr. Pino will talk about those numbers, and I can tell you that they're up significantly even from just yesterday. I am aware that many people regard April 1st as April Fool's Day, and while I wish much of what we'll discuss today wasn't true, but it is. We have some serious matters to discuss before all of us as we look to deal with the various things associated with the pandemic. In the midst of this coronavirus pandemic, I want to remind everyone that today, April 1st, is National Census Day. And today was the deadline for submitting your completed census forms. But the census forms, the deadline for submission of the census forms has been extended until August the 14th, August the 14th. But while we have many people who are at home, there's still an opportunity for our families to complete those census forms and to really return those questionnaires. You can easily do so either online or by phone. During times of emergency, our census numbers play an important role in making sure that we can access our share of federal funding for emergency management and response. It also impacts our ability to provide adequate health care, meal assistance, and crisis relief to our community. So it's not too late for all of you to make sure that your household is counted. For more information to complete the questionnaire, go to my2020census.gov. This is particularly important given federal funding to be allocated pursuant to the CARES Act, and all other federal allocations are often based upon population counts. Now, let me just share some other information with you. Even as we are managing the COVID-19 crisis, we are still monitoring other crises in our community as well. The drought index reached 500 yesterday, which indicates that we have extremely dry conditions right now, and the threat of a potential wildfire is high. Yesterday, a burn ban automatically went into effect in accordance with Orange County's ordinance. Per the ordinance, the ban will remain in place until that drought index dips below 500 for 7 consecutive days. Please remember that emergency personnel are already working tirelessly, and that we need to make sure to prevent any wildfires that can cause undue stress on our Orange County Fire Rescue personnel remains important. Today we learned that 2 additional Orange County Fire Rescue firefighters have tested positive for COVID-19, which means that currently 3 of our firefighters have tested positive for COVID-19. I can tell you that at this time, that none have thankfully required hospitalization. All 3 of them remain in self-isolation. Please remember our first responders and healthcare workers who are on the front lines combating the public health crisis before us. The latest Orange County numbers from the Florida Department of Health, if you go to the website, it will show that that number is now over 400. Dr. Pino is going to talk about the number. Dr. Pino has been a great partner in working with all of us here in Orange County to make certain that we understand what the numbers are for our community. I'm going to talk in a few moments about a heat map that shows an overlay of where the cases are occurring here within Orange County. We also heard from the State Emergency Management Team that the age requirement has been removed as a qualification for the drive-through COVID-19 testing site at the Orange County Convention Center. You still must have symptoms and a temperature or a pre-existing condition. All healthcare and EMS personnel are eligible for the test regardless of symptoms. As of about 11:50 a.m. today, the site reached capacity in fulfilling its daily 250 tests. As we announced yesterday, due to the overwhelming response of residents and with more than 30,000 applications, as of 1 p.m. today, Orange County government has closed its COVID-19 rental assistance program effective today. Over 30,000 applications. That just speaks to really the gravity of the need in this community for financial assistance related to this pandemic. We launched the program 12 days ago, and that meant that it was really for a stopgap measure to help Orange County residents until federal and state funding was available. The federal and the state funding processes have been established, and so we hope that some of those 30,000 who we may not be able to assist will be able to receive assistance through these other means as well. The program that we announced is taxpayer funded and was initially set up to help 1,500 families pay 1 month's rent and had an initial budget of $1.8 million. We will exceed that, and I really look forward to discussing our plan more with the Board of County Commission as we move forward and discuss other options that we may have for assistance. We do ask for the patience of our public as we move forward in terms of the processing of the 30,000+ applications that we received. Rest assured that our staff will follow up with every applicant. Let me shift gears a little bit and talk about some data analytics that will drive our decision-making going forward. The number of COVID-19 cases in Florida and in Orange County are certainly increasing. They are increasing across the country. A model from the Institute of Health Metrics and Evaluations show that our COVID-19 cases will peak somewhere between the end of April and the first part of May. When we reach this peak in Florida, we will be experiencing more than 170 deaths per day statewide. If these models are accurate, which I believe they are, we will have nearly 7,000 deaths in the state of Florida during this time frame. We have data analytics from national, state, and local sources that validates that our stay-at-home order as an appropriate strategy to mitigate the spread of the COVID-19 virus here within our community. Let me refer you to the maps that you see to my left that show hotspots of reported cases in Orange County. There are 53 zip codes in Orange County, and on that map, we have 38 zip codes that have at least one case within the zip code. But the most, where you see the reddest spots on that map, there are several zip codes that stand out as our hotspots: 32801, 32822, 32839, 32837, 32824, and 32828. But do not be deceived by the map, because there are other zip code areas that have much of that pinkish hue there. That means that they're on the map. That heat map can change daily based upon the spread of the virus itself. So we are here today to talk about what we will be doing moving forward. I want to speak briefly about this week. This is going to be a pivotal week for our nation, state, and here in our local community. I plan to meet this coming Friday with hospital executives to provide a laser-like focus on data specific to Orange County and related to mitigation and response efforts here. We are planning for what I would call a surgical-like strike to stop the spread of COVID-19 here in this community. I'm glad to see the governor's statewide order, and we're deciphering what it means to us here in Orange County. We're deciphering what that means to the executive order that we have here for stay at home. We will likely need to extend our stay-at-home order. It has some fairly unique nuances to it, but certainly we intend to follow the order that the governor has laid out earlier today. Other models, I might add, reveals that our heat map is showing various cases of COVID-19, but if your area does not look like a hot zone, again, don't be deceived or misled that you don't have to stay apart in order to stop this virus. According to the CDC, as many as 25% of us can be infected with COVID-19 but not show any symptoms. So it is important that the warnings that we have put in place are heeded by everyone in this community. At this time, I'm going to ask Mayor Dyer to come forward and share some thoughts with you, and then we'll move from there.
Thank you, Mayor Demings, and good afternoon. Orlando, we are strong. Together as a community, we've experienced multiple hurricanes that had devastating effects, the tragedy at the Pulse nightclub, which took 49 lives, and now the greatest pandemic we've seen in our lifetime. But the power is with us and our actions to contain this virus, to overcome the fear that it brings and stop the spread and save lives right here in Central Florida. And I know, Orlando, that we're up to the challenge. And I've seen bravery and courage and strength everywhere I look. I see bravery every single day. Our healthcare professionals, our nurses, our doctors, heroes who are working around the clock to save suffering and save lives. Our first responders who are on the front lines risking their own lives. Our city workers who are picking up garbage, parks, permitting. Our truck drivers and food delivery services and grocery providers that are making sure that our residents have their essential needs met. Our teachers, our administrators, our parents who are ensuring that our children are continuing to receive quality education. Our Regional Commission on Homelessness, our outreach teams, and our homeless providers are making sure that we're not forgetting about the least among us. And just today, as Mayor Demings mentioned, other Orange County firefighters, one of our members of the Orlando Fire Department received notice that one of the administrative staff had tested positive for COVID-19. This firefighter doesn't come in direct contact with patients. He had flu-like symptoms a little bit earlier this month and initiated self-isolation. He remains in isolation, although he does not have any symptoms at this time. As Mayor Demings mentioned, the future days and weeks ahead are going to be challenging, but I know we have the strength to get through it. Recognizing the ongoing impacts in the city of Orlando, we're extending the cancellation of events for more than 10 people until at least the end of April. We're pleased that the governor has now acted to extend a stay-at-home order to the rest of the state. We believe we acted timely and have saved lives just by taking that action last week. We will continue to stay at home. We'll continue to stop the spread. We'll continue to save lives, and we'll continue to support our local businesses and residents. We should be donating to not-for-profits who help the most in need. We should be ordering delivery from our local restaurants. We should be purchasing gift cards and making purchases from local businesses online. We should give blood. We should donate non-perishables to Second Harvest. We should connect with our neighbors and our friends and our families in need through 211 and Aspire's dedicated mental health line. And yes, we should fill out our census, because every formula that distributes money from the federal government or the state government relies on those census numbers. And there's a lot of people at home with not much to do, and filling out your census is a civic responsibility that you can take care of. As a government, we'll continue to advocate for our community's needs, for your needs, with our partners here in Orange County, the state government, and the federal government. We'll ensure that our healthcare workers and our first responders have the supplies that they need in the weeks ahead. Orlando, together, we are in this together, and together we'll get through this. Thank you. Dr. Martinez.
Thank you, Mayor Dyer. And continuing with conversation about PPE, I wanted to give an update. Personal protective equipment is what PPE stands for. Orange County ESF 8 has requested over 700,000 pieces of personal protective equipment from the state. Today, we have received 14% of that request. Of the 700,000 plus pieces of equipment, about 33% are N95 masks. And we have received about 15% of that request. We do not have to stress the value of the N95 masks. The people in the front line of this pandemic know the value of this resource to protect their lives, the lives of their families, and the lives of everyone, or maybe, and hopefully not, somebody in this room who might need their help. We know that there's a nationwide shortage of N95s, so we are calling on our healthcare partners to follow guidelines to ensure that N95s will be available when Florida reaches the apex of the epidemic or the pandemic, which, as Mayor Demings mentioned, could be towards the end of April, beginning of May. As a reminder to all of us, on March 20th, Governor DeSantis signed an executive order Order 20-72, Emergency Management COVID-19 Non-Essential Elective Medical Procedures, whereby he directed all hospitals, ambulatory surgical centers, office surgery centers, dental, orthodontic, endodontic offices, and other healthcare practitioners' offices to discontinue providing medically unnecessary, non-urgent, non-emergency procedures or surgeries. And as many of you know, and those in the health profession know, that the burn rate of PPEs, specifically N95s, is very high when engaging in those types of procedures, surgical procedures. As I mentioned before, through the Office of the Emergency Medical Director, we have placed and continue to place orders for personal protective equipment from the state and distribute those as soon as we receive them. However, locally, we need to be diligent and good stewards of our resources. So again, we're asking our healthcare partners to pay attention to the fact that the governor had requested hospitals and other care facilities to discontinue non-emergency procedures. And with that, I'll turn it to Dr. Pino, who will talk about the public health numbers.
Thank you, Dr. Martinez. Thank you, mayors. I would like to thank the press for continued coverage. And it looks like it works because we have seen a significant reduction on the number of calls that we get into our call center, which probably means that the general message is getting to the public and there are less of those general questions. We continue to operate our site at the east side of the county, and to give you a general date, the official data for the county at 11 o'clock this morning is 392 positive, although we will see a significant increase in the coming days. And probably by the end of Friday, if we continue with this rate, we could reach close to 500. The range of the age from 0 to 91, and every time that you see 0 in CDC collected data, it means that there is an individual who is younger than 1. They don't record months. Our county has tested 3,602 individuals. 13, as we know in the data, are waiting for the results right now. And we have 64 hospitalizations. That went a little bit up from the last time that we talked to you, as well as the age has decreased a little bit. We are trying to calculate. Last time that we looked at it was 47 years old. It looks like the epidemic in our county is affecting younger individuals. We have a positive testing rate of about 10% of all the tests that we are doing in the county. Previous to this, it was less than 7. So that, with the number of hospitalizations increasing, it may be an indication that the epidemic is taking a hold in our area. And as we have spoken before to you, the epidemic here seems to be running like 2 weeks behind other harder hit cities like New York City or Miami. That's why the next 2 weeks are very critical for us in continuing to prevent the spread of the disease. It is in our control. It is in our control to stop spreading the disease around. Social distancing, hand washing, and staying at home as much as you can, and only going out when it's absolutely necessary. We have conducted in our site about 200 tests. 32 of those have come out positive, and we continue to do testing, and if necessary and we have volume, we will do it through the weekend. The number to make those appointments is 407-723-5004. Again, 407-723-5004. En español, el número para llamar para hacer cita para hacerse la prueba es 407-723-5004. The city of Orlando has the highest number of cases in our county with 272. Winter Park has 21 cases. Windermere has 16. Ocoee 12. Apopka 8 cases. Winter Garden 8 cases, and Midland 7 cases. I continue to suggest to people to use the CDC app that was developed with Apple. It's in the Apple Store, and it has a lot of information that you can derive from it, and it's secure. They don't collect any data on you, and the information has been validated by the CDC. Other sites, other websites, other informational sites has a lot of misinformation. I also want to recognize our mayors and the efforts of the city and the county on securing adequate conditions for the homeless that needs to be isolated, and we are ready to engage and help as much as we can. Thank you.
Okay, we'll open it up for questions in just a moment, but I wanted to say, even when we look at the data associated with the zip codes, sometimes it can be a little bit misleading when we indicate a particular city, only because the way it works here in Orange County, there are many unincorporated residents who may have an address within a particular city, but they're really in the unincorporated area. So when you hear that number of 272 in the city of Orlando, that may be a bit of a misnomer, because many of those addresses are technically in unincorporated Orange County. So which is why, in terms of trying to understand precisely what we're talking about, sometimes we have to look at the zip codes. We do have data that is able to look more specifically into a particular neighborhood, but because of various HIPAA laws, et cetera, we have not put that up. But trust me when I say that when we look across Orange County, there are cases in every particular quadrant of this county. It's widespread in Orange County in terms of the spread of the virus, which speaks to the reason why we are here today to double down on urging our citizens to heed the warnings that we're putting in place. These numbers are beginning to increase. Now, while we said that the state's website indicates, again, somewhere around 393 cases, Dr. Pino has said to me that he knows that before the end of today, when those new numbers come out, it will be over 400 cases that we're talking about here in Orange County. To put that number into perspective, once again, other than Miami-Dade, Broward, and Palm Beach counties, Orange County remains in that fourth place in terms of how we stack up against the 67 different counties that exist here within the state of Florida. Our concern is that we work in collaboration across the entire region to make sure that our response, our mitigation efforts are unique to the experience that we have here. We are going to rely on the data that's being collected within our hospital systems. We know that while there have been many tests done, many of the tests that have been given and where we have received confirmation is coming out of the hospital settings. And so they are very important to the short-term and long-term strategies that we have to put in place to deal with this pandemic. So with that, let me open it up for any questions that you may have. And I would remind you, if you're Spanish-speaking media and you have questions in Spanish, you can ask them now. If you have a question of any one of the participants here, while they're here, we'll try to respond to any questions of that individual at that time before we kind of move on to kind of just manage the time. So we'll go to the wait a minute, we're over here. The microphone is on this side, so we'll go to this side first.
Yeah, my question is for both of the mayors. In the name of safety, many believe that governments across the country have moved up to the line and some across the line in violating people's rights, freedom of movement, going to church, things of that nature. So how far are we willing to go for safety when it comes to maintaining the civil rights of everybody in the state and in the county?
Okay. While that question on its surface kind of insinuates that we're doing something outside of what we should be doing as a community, and I will push back on that and say that we're going to go up to the line where we ensure that we're saving people's lives, we're saving people from themselves in this case. Whatever we do will be lawfully done. We certainly are, I think, sensitive to individual rights, which is why we have had the measured approach that we have done at this point in terms of any orders that we have put in place. But we're going to do what is necessary to protect the greater good, the greater humanity of this entire community. Okay. In the back. Yes, sir.
Mayor, I'd actually like both mayors to respond to this question. What are your thoughts on the decision today by the governor, and was this, should it have been done much earlier?
I'm going to be transparent. It should have been done earlier, and we agree with it. At least I do. Mayor Downer.
I think the governor came under a lot of pressure to act in the manner that we did 10 days ago, I suppose. And I wish that the entire state would have been put in a stay-at-home order back when Orange County instituted it. And you know that Osceola County, Pinellas County, and Hillsborough County all did it about the same time we did. So the governor did the right thing today, though.
I'm taking some questions from media members that are not able to attend. So Jennifer from the El Sentinel here in Orlando would like for someone to explain in Spanish, if possible, how important it is to stay at home and what that entails. People are commenting online about nothing changing from what was ordered before and that people keep going out. So what message can you stress here so people stay at home?
So la parte importante es que el virus es un virus pesado, tiene un contenido de proteína muy alto y cuando uno habla cae inmediatamente al suelo, o cuando estornuda va un poquito más lejos, pero cae al suelo. Por eso es que es importante esa distancia de 6 pies entre las diferentes personas para mantener la distancia segura a la cual no vamos a adquirir el virus. Con respecto a las personas que no están acatando la orden, nosotros tenemos el poder legal para poner en cuarentena legalmente y bajo la ley a cualquier persona que no esté ejecutando la cuarentena a la cual se le ha aplicado las restricciones. No va a haber ningún problema si tenemos que aplicar. Pero parte de esto es nuestra conciencia individual con respecto a la comunidad y la protección de los demás. Cada cual tiene un papel a jugar en esta situación.
Thank you. This next one is from Matt Lipoli from West 2. What are the next steps in trying to help people who are worrying right now that they won't be able to pay their rent? And this is in reference into the assistance rent program. And those that are, when the need is too great, you know, when this program launched, what are options for those people now?
What I would say to the individual, if he is one of the persons who has already made application for the rent assistance here within Orange County, we'll process it in accordance with the guidelines that have been established. If he is not one that was able to apply before the deadline, or if that person is not an Orange County resident, then the application process for accessing the CARES dollars that have been made available through the federal government. What I'm hearing from members of Congress is that within the next couple of weeks, there should be a definitive process, and maybe even by the end of this week, individuals who will be able to apply for that or change their address to be in the system whereby they will send out the checks, they are able to do so. I do know that in terms of the small businesses, that process is already in place, and I have talked to some small business owners who have already gone online and made application for the funds that will be made available through the Small Business Administration. And so I would tell that person also pay attention to the various websites, because we do put up new information and relevant information several times throughout the day, almost hourly, about how individuals may be able to apply for various types of assistance. I also will say that here within Orange County, we have an assistance program for to help with utility payments for those who have heating and air conditioning challenges. We have a standing program here within Orange County that they can also apply for funds there. And again, that information is posted on our website so that they can be able to get some assistance within their respective household. Mayor Dyer, I don't know if there's anything you want to add to that at this point? No. Okay.
Mayor, I have a question for Dr. Pino. With the number of positive cases that we've had, do you know if there have been any discussions for healthcare workers who maybe work for children's hospitals to prepare to to work in other capacities?
So as Dr. Pino comes up, if there are other questions of Dr. Pino, let's ask him all while he's standing here at the microphone.
I don't know, but that's a very interesting question. So I will be reaching to the Children's Hospital to see what the capacity is going to be to do something like that. There has been also some initiatives to try to call healthcare providers who are in retirement. And also we have had a number of volunteers that have expressed interest of helping many medical students and others that are now engaged in regular activities right now have reached out to us to volunteer, and we are using some of them as well.
Dr. Pino, when you look at the heat map and the projected peak, what does that information tell you, and what have you learned from this heat map as we kind of move forward in this next month before we hit the peak?
So the heat map, what will be interesting is seeing over time. And this is the first one that was developed by the county. So when you see these heat maps over time, and you have the ability to actually watch it like a movie, how it moved and how the epidemic changed through the city. The utilization of these type of approaches is also that it will help you to target specific areas for testing when we have the ability to brought up testing at a larger scale. And you will be able, it may not be this exact heat map because it's going to change, but you will be able to identify the areas in the city where you have the highest concentration. What you can do with that, you can do targeted testing, you can do targeted messaging, you also can advertise and do very specific things that are in specific, that responding to the specific needs of those areas.
Félix Pirela de Telemundo, tomando en cuenta declaraciones del propio presidente Trump y las autoridades federales que indican que el pico de esta curva será dentro de 2 semanas y las proyecciones que ustedes hacen será para finales de abril, principios de mayo, ¿es suficiente la orden de quedarse en casa, tomando en cuenta que viene quizás lo peor de esta pandemia en esta localidad y tomando en cuenta que esta orden quedarse en casa aplica a negocios esenciales que es tan amplio desde supermercados, farmacias hasta negocios de ventas de armas? ¿Es suficiente o se verán obligados en los próximos días a aplicar una medida más radical como un cierre total?
Es una pregunta interesante. Yo no tengo la autoridad de aplicar ese tipo de medidas, es para los alcaldes, pero lo que sí te puedo decir es que la base de datos está demostrando que esos lugares donde se aplicaron medidas muy restrictivas están teniendo mejores resultados que los lugares que no la aplicaron. Lo interesante en Florida va a ser ver los lugares como our county, que la aplicaron primero que otros lugares, y ver si hay alguna diferencia entre la curva y cómo se mantiene.
Doctor, two-part question for you. Are you able to learn from some of these patients how they got this, if it's in a group setting, if it's because they're a family member? And does that information kind of let you guys know how to base some of these restrictions, or I guess when you're talking with the mayors about the restrictions? And then secondly to that, do you, in your medical professional opinion, do you feel like there is more that can be done on top of the stay-at-home order to limit some of that?
So those are very interesting questions and fine line to walk, especially the second one. But with regard to should we apply more restrictions? So the data is showing that those places, and I was just saying that in Spanish, that have applied restrictive measures are having better results. In our case, in the state of Florida, we will be able to compare maybe in a couple of weeks. If our county that applied these measures earlier than other regions in the state will have a better outcome. So that would be very interesting to look at it from an analytical point of view. That would be very interesting to look at. Are we learning from everyone? Absolutely. What I have learned the most is that asymptomatic people are playing a role in the transmission of the disease more than we initially thought.
Dr. Pino, quick question. A lot of the decisions seem to be being driven by the modeling from the CDC and the Institute of Health. I wonder if you could talk about that, because, for instance, in 2009, the modeling they did for H1N1 was extremely higher than the amount of people that actually ended up passing away from it. And I'm wondering if something similar might be happening here as well.
It could be. A model is as good as the data that you enter into it. And a model constantly changes. So a modeling is basically a mathematical equation where you said, if we have this condition, if we have that many people with this percentage of the population and this rate of infection, this is what is going to happen. And it takes into consideration what is happening today. But because we are applying these measures and maybe more measures will be coming into place, that outcome may change. So the modeling that is done today takes into consideration the data today and the conditions today and not what is going to happen tomorrow. That's why it could be a difference in the N1 case.
We'll take one more question.
Dr. Pino, you mentioned that there are several children.
Orange County and Orlando officials with their daily briefing on the coronavirus pandemic and the battle to fight it here in our community. We've been listening in for the last 40 minutes. Really some sobering numbers that we're hearing in this news conference, saying that Orange County positive cases could hit 500 by the end of the week. And also this projection, this data from the National Institutes of Health saying statewide during what's expected to be the peak here in Florida, which would be later this month, the end of April toward the beginning of May, that statewide we could see in excess of 170 deaths per day. And that 7,000 deaths total statewide is what they're projecting there. But also Mayor Jerry Demings in Orange County saying we're going to take a surgical-like strike against this disease. He mentioned that after saying he's going to be meeting with some hospital officials later this week. And then Dr. Raul Pino, the health officer, saying, though, it is in our control to stop spreading this disease around. Again, talking about all the things that we can do. So much that we can't do with this, but some things that we can do in terms of social distancing and obeying these stay-at-home orders as well. Greg?